The Libyan Digest.
The Libyan Digest is brought to you by the Libyan Observer.
Hello and welcome everyone to the first episode of the Libyan Digest. The Libyan Digest, of course, is brought to you by the Libyan Observer.
Hello and welcome everyone to the Libyan Digest. As my colleague said, Abduljalil said, it's brought to you by the Libyan Observer. I am Aisha Shaka. I will be with you with Amin at this show. This program is basically discusses the Libyan situation on all aspects, the Libyan society, what we are facing today, what we will be facing, the current situation. So stay with us.
As you have mentioned, it's going to be a weekly show, but today is a special podcast. Today we are going to discuss a special issue that has invaded the whole world. Today we are going to discuss a lot of things about COVID-19. Yes.
Today we'll be stating facts, actually. What we are facing today, the rumors that we hear, distinguishing between facts and rumors, bringing to you what is going on really, not just things we hear on social media or on the street.
Especially after the cases we have in Libya and the mess, let's say, that has happened after we have discovered these cases.
As everyone is hearing, you basically know what we are going to talk about. We are going to talk about what we've been invaded, what have invaded us, which is COVID-19, the virus, which people know as coronavirus. Of course, we will not be talking like as a specialist.
Yes.
We will be having specialists that talk about this disease. But what we all know is that today it's just we're facing a disaster, natural disaster. So,
but when in this matter, we have to show or we have to apply in a balance. We don't have to be panic, and we don't have to be, let's say, behaving in a randomly way, maybe. So we have to show a balance. We have to relax and be quiet in dealing with such issue.
Yes. Before we go into details, I just want to say that, like, today we will be having specialists and people who care, and in this case really matters too. Today we'll be having here at the studio. We're gonna have Dr. Ali Eljabo, and also we'll be having on the phone the health officer at the UNICEF, Dr. Mohamed Abugalia, and also the ambassador in Libya. We will be talking about the COVID-19, and we'll be discussing the Filipinos people here in Libya.
Yes. Our dear listeners, before starting our discussion with Dr. Ali Eljabo, let's start our episode for today with these news about the cases we have in Libya. The Libyan National Center for Disease Control has announced 5 new positive coronavirus cases in the country, bringing the total number to 8. The center has announced on Sunday the reference laboratory in Tripoli had received 12 samples for people who were in contact with the woman who contracted COVID-19 in Musrat.
We have on the phone Dr. Mohamed Abugalia, the health officer of UNICEF. Dr. Mohamed, do you hear me?
Yes, yeah.
Hello and welcome to the Libyan Digest broadcast.
I'm very delighted to be online.
We would like to welcome you today. And of course, we would like to discuss about you, with you, the current situation.
Yes.
Yes, Dr. Mohamed Abugalia, we have heard a lot about how COVID-19 is worse in elderly people and those with pre-existing medical conditions. But what about kids, babies, and pregnancies?
This is the issue. This is all the scientists talking about this issue.
Mm-hmm.
Actually, it's a new disease. So a lot of aspects is not known about this disease. But statistics showed that lower number of children infected with COVID-19 compared with other respiratory viruses.
Mm-hmm.
In addition, for children who get infected, it's likely to be severely ill and have the lowest risk of dying from COVID-19 compared with other age groups.
Mm-hmm.
This is the fact so far.
Mm-hmm.
Usually with respiratory viruses, children tend to get more ill, and they are more often responsible for transmitting the illness, but this does not appear to be the case with COVID-19.
Mm-hmm.
Mm-hmm.
It's more mild.
Okay.
Mm-hmm.
For instance, studies that looked for in China for about 1,390 children who were close contact or of confirmed COVID-19 cases, and it found that 12% only of them had infection. Mild infection.
Mm-hmm.
Other studies showed that some children become severely ill and require intensive care, but they have underlying lung condition or are immunocompromised. The immunity are very naive or very low immune system they have.
Mm-hmm.
Anyway, in general, the younger the child, the higher the risk. This is fact.
Mm-hmm.
If the child under 5 years of age would be at more of risk of most diseases, because he hasn't developed immunity.
Mm-hmm.
But there is no any published convincing data showed that this is the case in the COVID-19.
Mm-hmm.
Mm-hmm. Okay.
So there is a lot we don't know about this disease.
Mm.
Yeah.
Yeah.
And this is the problem, maybe. We don't know.
Yeah, this is exactly.
Mm-hmm.
Yeah. So, Dr. Mohamed, another question.
As a part, I think, as a part of pregnant ladies, I didn't answer that.
Mm-hmm.
Yeah, about the pregnant lady, all doctors, even the people knows that the immune system during pregnancy very naive, and any pregnant lady has a low immunity.
Mm-hmm.
But the pregnant women are often considered to be a higher than average risk from infection.
Mm-hmm.
But again, there is no any good evidence
Mm.
that pregnant ladies are at high risk from COVID-19 infection.
Mm-hmm.
In summary, pregnant women does not seem to become more severely unwell from COVID-19.
Mm-hmm.
Anywhere in Italy, in China, this is those countries who have the highest number, at least.
Mm-hmm.
Infection doesn't seem to increase the risk of miscarriage, abortion, during pregnancy. There is no evidence the virus can pass from pregnant mother to baby.
Mm-hmm.
There is no evidence the virus will cause abnormality in the unborn baby.
Mm-hmm.
Okay.
A cesarean section or induction of labor does not seem necessary to reduce the risk of transmission of the infection from mother to child.
Mm-hmm.
The other thing, some babies born to women with symptom of COVID, the mother has the infection, but still the child, there's no proof that the child will get the infection.
Mm-hmm.
Mm-hmm. Okay.
The other thing, newborn babies and infants does not seem to be increased risk of complication, any sort of complication. COVID-19 does not seem to pass from mother to child through breast milk, even during the lactating.
Yes,
During the period of lactation, does not cross from to the child from through the breast milk. So
Yeah.
breastfeeding, I have to confess in this. I would like to stress on this point. So breastfeeding is still engorged, although the women with the virus, I mean the mother infected, should be extra careful than the normal one. With hygiene practices, wearing the face mask, and other things, that precaution measures that we all know.
Doctor, another question. What about the people who get the virus and recover? Do they get immunity? Is their immunity much stronger? Or
Yes. This is one of the most pressing questions. This pandemic. The answer is yes.
Okay.
For example, the last week, FDA, Food and Drug Administration in Europe, approved the use of plasma from infected people, from recovered patients, to treat some severe cases. They're taking the plasma from the blood and use these antibodies, this plasma, to treat other patients. That would be particularly useful for the healthcare workers who know they have at least some immunity. Some of healthcare workers exposed to infection and recovered. So actually, they're using just the front line because they already immunized. Yes.
Okay.
Thank you, Dr. Mohamed Abugalia, for your time. Thank you. Appreciate
Thank you very much.
Appreciate.
Thank you to the health officer of UNICEF, Dr. Mohamed Abugalia. Also, it's so heartbreaking and sad to hear about the new cases in Libya.
Yes.
And especially that we don't know anything about them or any. It's just something that is surprising and shocking that we heard that we have cases, and we're not sure if it's the number is going to be higher. Nobody knows. Therefore, we would like to welcome our guest at the studio, Dr. Ali. Hello.
Hi, how are you?
Good, thank you.
Yeah.
Yes.
Thank you so much. Thank you for having me here, and it's my pleasure to be with you on your show as Libyan Digest.
It's our pleasure to have you today.
Thank you.
Dr. Ali, we, as people, normal people, we would like to know more about what we are facing, what we are going to face. First of all, what is COVID-19?
Yeah, the COVID-19 is one of the viruses belong the group of virus called coronavirus. What's coronavirus, or what's mean of corona in general, is what from where that the name came. Usually the virus have like an envelope, like a crown, so it's coming from Latin word is called corona, so it's like crown. It's covering the RNA or the gene of the virus. So the coronavirus, COVID-19, is in general are zoonotic. I mean, it's viruses affecting or infecting the animals and transmit the virus from animal to the people. So it's called the zoonotic virus. So this virus is usually causing mild symptom and sign. It's like illness, general illness, or like a fatigue, sometimes a headache and fever. So in general, it's like a mild symptom and sign of if the people got infected of coronavirus. So it's not like I mean, like highly causing serious condition to the people, but in some certain cases may lead to those serious condition if the condition get more serious or dangerously affecting the health system in general in the body. I mean, especially in the elderly, or they have some chronic disease, or some the immune system is low. So and those people is like the minimum percent of in general. We cannot say that it's like a dangerous disease or like a killing virus or something. No, we cannot say that, and we cannot do like a panic. It's not like a small percent of people get infected, maybe get worse conditions. But in general, maybe some of the people get infected of the virus. Sometimes asymptomatic. I mean, sometimes have no symptoms or signs. Some of them mild symptoms, and some of them need more care about.
Let's discuss maybe the matter of the spreading of this epidemic or this virus.
Yeah.
Can we say that the bad habits of Chinese people cause this disaster in whole the world? Maybe the bad habits about the food. Many of people said that Chinese people are eating strange things.
Yeah,
Yes.
we can. Yeah, we cannot judge on that. To be in general, we cannot judge on that. It's kind of its behavior in each country or whatever. I mean, it's all about the studies from where it comes to how transmitted, how to mutation, all of these things, because the virus has the ability to the mutation or the change the gene to be able to transmit from the animal to the it's like we have history in the last couple of years on maybe the in the past, like the MRSA or the SARS or all of these kind of viruses that is animal origin. I mean, the virus in general has the ability to mutate and to change the gene code to be able to transmit from the animal to the people. So yeah, it's kind of. It's under study and nothing confirmed it. So, but to keep in mind that the ability of the virus itself to mutate. This is the main point of that.
Okay. Dr. Ali, earlier you and even Dr. Mohamed talked about immunity, okay? We would like go a little bit deeper in that. We asked Dr. Mohamed about the immunity of kids, the immunity of pregnant women. He also said nothing confirmed yet. However, they should be more careful. What is your opinion about the immunity itself? Is it really effective that if we have strong immunity system that we will be facing it would be easier for us?
Yeah, this is the main point, and this is the main goal of the immune system in the body. I mean, the immune system of each single person is like the shield protecting our bodies from to being infected or affected by the viruses or bacteria or the other pathogenic. I will give one example from our normal life that we are doing. The babies, once they born, and they should go do the schedule of vaccination. So some certain diseases and some certain viruses or bacteria, we can say long life immunization. If you give them the vaccine, if we said that we give them the vaccine when they are younger age, they have long life immunity for certain diseases. But unfortunately for the influenza, it's kind of different, because the ability of the mutation and the change of the gene of the viruses make it difficult to have this kind of long life immunity. There's some cases recorded now, or there's some studies recorded now, some people get affected twice by coronavirus. So this means they don't have long life immunity, but for the current infection, they and the recovered people, they have such kind of antibodies against those viruses. So But in general, for the normal people, we should take care of our bodies, and we should take care of our immunity. I mean,
Yes.
we have to be in health, in good health situation. Take care of our food, take care of our hygiene, take care of our lifestyle. I mean, taking some of people which they have high risk. Sometimes we recommend to have like a supplement to improve their immune system. It's not like a proven study, but it's like like precaution or like change of the lifestyle and all of these things to be. If for certain moment get infected, the consequences of this infection will be more low. I mean, some of them, like I mentioned earlier, some of the people get infected, but there's no symptoms. That's mean their body immune system is strong. So they are facing and they are affecting the fighting against this virus. So once the immune system is good, our health
is going to be
our health is good. So that means more or less consequences. Maybe you get the virus, but the consequences of this infection will be low.
Yes,
but it's always better to be more careful.
Yes. It's not like this advice for only for corona. I mean, in general, if we have like a lifestyle to be more regular and more healthy and all of these things, this will be it's good for all people to be in safe side.
We have talked about the panic and it's an ordinary status that you are going to face in this issue. What would be the process if I suspected that I am infected, Dr. Ali?
So I can speak here in Misrata in general. What's the steps and what's the procedure can be taken here in Misrata to be general. I mean, if I'm suspect for myself or anybody's ask me for advice or whatever I can do. If you are coming from abroad or if you are having contact with people coming from abroad recently,
you have to be responsible.
Yes, you have to be responsible on that. The quarantine the things is important. First of thing, I mean, to be in safe side, I mean, for you and for your family, for your relative, for your beloved one, for the community itself, it's good to have such kind of self-isolation in the house. If you are suspect for yourself or for anybody, they have the contact numbers for the call center or the surveillance team here in Misrata. They have their phone numbers published everywhere. You can contact them whenever you want. They have opened their phones 24 hours per 7 days. So you can contact them. They will ask you some questions. No, don't be scared. It's like usual thing. They have like a scale to be monitored. They have a criteria, if I can say that. They have a criteria to follow your case. I mean, if you have some score, kind of score belong your case, they will advise you what you do. If you have lower score, they will ask you to stay home, keep safe, isolate yourself, take a lot of fluid. If you have low-grade fever, just take paracetamol tablets and stay home and don't leave it that.
Yes, in this condition, maybe let's talk about your opinion about the case of Misrata. Nowadays, we have six cases has infected.
Yeah.
So, what do you think about the general status here in Misrata?
In general, I will say something that at least the people don't be panic or don't be scared. If you get coronavirus, that means that you are in dangerous condition. condition or in serious condition. No, the cases, they are in home, they are in safe, they are just taking care of themselves. They are followed by the doctors all the time. They check them. I mean, they are not hospitalized. I mean, their conditions are not serious.
Yes.
So it's like, it's not a shame that you have the coronavirus. It's not, don't be scared and don't be panic. Just to stay home, take the recommendation, what the doctor tell you to do, and keep in touch with them, and they will keep touch with you as well. So I mean, no need to be in panic or to be scared. So in general, the situation for those cases are very smooth, and they are doing well and getting better, and hopefully they will get better and better, inshallah.
Okay, this maybe answers my next question, but we need to be more detailed. How prepared are we for this, to face such thing?
Okay, maybe I'm not in a position that I will speak about the preparation things in the city, but
just your opinion.
But from my colleagues and from my colleagues in the municipality or in the hospital or on the primary healthcare centers that now announced to be the primary examination places that should be people directed to. I mean, the municipality that's initiate or creates the High Commission Committee for anti-corona pandemic. There's many group of teams. They have tasks. They have all of them the things they should to do. I mean, now for the meanwhile that we are speaking, they are preparing the 3 places to be the primary healthcare center to receive the suspected cases.
Volunteer ones.
As I will not say volunteer, there is people are employed for that, and the others supported by volunteers. I mean, the assistant staff, we can say they volunteer to help in running those places, and the place that also created to be the isolation and the treating center in Garara area, or we can say the Karshini hospital there. So this is the main steps now at the level of the municipality. They are created. So from me, I would like to have a general advice for the people, for our people, that follow the recommendation, follow the precautions that they are asked to do. I mean, the curfew time, the hygiene things, they avoid the crowdness, avoid the close contact with the it's like a international trend now, social distance. I mean, keep a distance between shake. So all those precautions help to contain the pandemic, or to contain the disease, or to cut the chain of the transmission. This is the most important thing. The dangerous in this virus, not the illness itself. I mean, not the disease itself. I mean, the ability to spread more wide. So this is the most important thing in this pandemic. The transmission issue, this is the problem. So all those precautions should be considered and could keep in mind in the population. This is the first thing. The second thing, contact with the people in the call center. Ask them. Pick up your phone and call that call center.
Do not be embarrassed.
No, at all. No, at all. I mean, call them. Ask for help. Ask for advice. I mean, if you are suspecting yourself, please pick up your phone. They will help you. They will tell you what you can do, and they will advise you which places you can go. And if you suspect in yourself, don't go to the public places. I mean, in the public hospital and even the private hospital, there's allocated places. There's special places for the suspected cases. The call center people, they will ask you to go then. Yes. Also, the people in the call center, if you give you the high score, I mean, they will advise you to go for those primary healthcare centers. the call center people, they will contact with those primary health center and they give them the data for you, and they are ready to receive you. So it's simple. It's I mean, it's as simple as it is, and
Yes.
can be applied in the whole community.
Okay.
It's a pleasure to have this discussion with you, Mr.
Yeah.
Dr. Ali, and
It's,
yes,
Pleasure is mine. Thank you
yes,
so
and
much.
Aisha. We are going to hear a story about cases in Singapore. 17 people has recovered. So we are going to have a break, and we will be back, inshallah.
The people you see behind me were all infected with coronavirus. I can't show you all their faces, but what I can do is tell you their incredible story. This is a group of friends and colleagues who work at a church in Singapore. Back in January, one of them got infected with COVID-19 over a family dinner. And without him knowing, he came to church and had a normal day. But little did he know that his virus was spreading like wildfire. 2 people got infected. 3, 5, 10, 15, 17 people got infected just like that in a very short time. No one knows exactly how it happened. It could have been a meeting, a sneeze, a handshake, or a cough. That's how contagious coronavirus is. And that's how an entire church was shut down. From headaches to fevers to intensive care units.
When I was infected and I was a confirmed case, that thought came through my mind that I would die because of the virus.
Each one of them had a different response to the virus. Some didn't feel it, others spent 31 days in the ICU. And the story doesn't end here. In addition to dealing with coronavirus, they had to deal with the stigma. The COVID-19 stigma is huge. At school, their kids were called COVID kids. Hotels didn't let their families stay, and family weddings were forced to be canceled. This is why we had to cover most of their faces. This tragedy was going to ruin their lives. But here is what we don't hear enough of. Facts. COVID-19 has a much higher recovery rate than we think, with over 98% of patients recovering. And for this group of friends, 100% of them recovered. 17 out of 17 of them healed from coronavirus. That is incredible. In no time, they went back to living their lives normally, full of energy and gratitude.
As the days went by, I realized that I wouldn't die because I felt strong at a point in time, physically, emotionally. I didn't feel that I was dying. Instead, I was feeling that I was recovering and growing stronger by the day.
Now they are donating their blood for medical research. Because of their donations, we can develop vaccines to save everybody else. If you're worried about coronavirus right now, tell your friends about these people. They are not just survivors, they are a source of hope for a future without coronavirus.
We're back to you after hearing these stories of people who have been affected and now they are treated and things are going well for them. The stories brings hope. Yeah.
Singapore, yes.
Yeah, in Singapore, they bring hope to us in a time where we really need help. We need hope. We need motivation to proceed and go and live live our life the healthy way
Yes.
and prevent ourselves and prevent our families.
Yes, and the percentage of people has been recovered around the world are very high. So about 80% or something like that.
Let's
So
look at the
it's-
full
Yes.
the full part of the cup, because we really need this. We need the positive side, not the negative side. Negativity is all over the world, not just here. Therefore, we need to look at the positive side. 80%.
We have a call.
Yeah.
Yes.
So now we have a call with the ambassador of Philippines in Libya, Mr.
Elmer
Elmer Cato.
Cato, yes. Hello, Mr. Elmer.
Yes, good afternoon to both of you.
Good afternoon to you too. I would like to welcome you, and I would like to thank you for your time to be with us today in the Libyan Digest podcast.
Yeah, thank you for having me. It's a pleasure.
Yes, Mr. Elmer. Let's give you the first question about the procedures that has been taken from Libya about the measures of COVID-19. How do you see these procedures?
Well, the embassy has really been monitoring the actions being taken by authorities here in Libya to prevent the spread of the coronavirus disease, and we are glad to see that a number of steps have been undertaken in this regard. We've monitored how authorities have started briefing hospitals, including medical workers, including Filipino nurses and other hospital staff. We have seen the acquisition of new equipment like ventilators. We are aware of the construction of isolation wards and the distribution of vehicles equipped with corona detection equipment. Of course, the lockdowns and the curfews being imposed all throughout the country. These are really critical steps that must be undertaken to prevent the spread of the disease. As we all know, there are now 8 cases, which are by far low compared to other countries overseas. And we hope it stays that way, so that majority of the population would not be affected by this.
Okay. Mr. Cato, as you know, the Philippine nursing staff in Libya is one of the maybe strongest or one of the best staff in the health sector. I want to ask you, do you have any process or any procedure that you follow for them, like for protection, for awareness, for the nursing staff in Libya?
Yes. As you know, the Philippines and Libya have established diplomatic relations way back 1976. And the first wave of Filipino nurses and medical workers started coming in soon after. So I'm sure the Libyan people are aware of the role played by Filipinos in the healthcare sector. And as I've been saying, our people have been here with our Libyan brothers and sisters and have never left. They stayed despite the problems encountered since 2011. We still have approximately 1,000 or so Filipinos working in hospitals and clinics throughout Libya.
Yes.
And as frontliners, we do expect them to play a role in the fight against the coronavirus disease. And they are well aware of this responsibility. They're not pulling out of their sworn duty to help those who are sick. So we do expect them to play a critical role as Libya confronts the coronavirus disease. So what the embassy has been doing in the initial stages, we requested the assistance of the World Health Organization and the National Center for Disease Control to conduct a symposium on the coronavirus disease, which we did on March 13, and it was attended by about more than 100 Filipinos, most of them nurses and hospital workers. So it was a very enlightening experience for many of them, since at that time some of the hospitals have still not started briefing their staff on the protocols and on handling the coronavirus. And of course, they do have some concerns, and of course, these concerns are concerns that are being raised not only here in Libya, but also back in the Philippines and in other countries overseas. So many of them were saying that, we are ready to help, but we need to make sure that we also have the proper equipment, to be able to protect ourselves. So I am sending a letter to the Minister of Health to convey this request of Filipino medical workers for them to be issued personal protective equipment. So that would give them the added assurance that they would be able to not only help, but also not get the disease. Because, Filipino nurses are a very valuable human resource.
Yes, very.
The same way that, all our medical workers here in Libya now. So if they don't have the proper medical equipment, and then they get exposed and get sick themselves, then we're going to have a big problem. So I think at this point, priority should be given in ensuring that all frontliners in the medical sector have the proper equipment to protect themselves, to allow them to continue helping us. Without those personal protective equipment, then we might encounter really serious problems in the near future.
Yeah. As you have mentioned, the Filipino medical workers have had a great part in 2011, and now they are facing this with us, and it's much appreciated, the work they do, and we really appreciate the effort, and I hope they are safe and they're facing it as strong as we are used to their work.
Yes, they are actually. In fact, we have been asking who among them would want to go home, but we have not been receiving any requests from a lot of them. We've been receiving some requests for repatriation from some medical workers who have finished their contracts and just are waiting for the financial aspects of their work to be settled.
Okay.
That's understandable, because with or without coronavirus, they are really supposed to go home.
Yeah.
But of course, I'm particularly concerned about, senior nurses who are in their late 60s, who are actually still working. So I've been trying to convince them since last year to maybe consider going home. But then they've been telling me, we're still needed here, because if we go, we play critical roles in the hospital and we don't have replacements. And I do understand that, because I came to realize, compared to when I was still in Manila, that the reason why most of our people who are still here would not go home is because they have felt the love and respect of the Libyan people. It was really an eye-opener for me when I came here. I said, why don't you want to go home? I said, no, because, sir, we're treated like brothers and sisters here.
Yeah.
We've never experienced this in other countries where we work.
Yes.
So that's the reason why you still have them here, and that's why they also will, again, risk their lives for their Libyan brothers and sisters. And I'm really, really gratified to see that outpouring of sentiments from the Libyan people in recent weeks.
Okay. Make sure that we appreciate the hard work they do, and also we appreciate the time you invested with us in the Libyan Digest. Mr. Cato, thank you for your time.
Thank you. Thank
And
you.
we're happy to have you.
Okay, thank you.
Thank you.
I
Goodbye.
appreciate it. Yes, so this is Mr. Elmer has highlighted a lot of things about Filipinos and about the procedures that has been taken in order to face this issue. Let's get back to our guest for today, Dr. Ali. We have talked about the immunity system, and also we have talked about the procedures that has been taken up in Misrata. Do you have another thing maybe to add in relating or regarding the case we have, especially in Misrata?
Yeah. First of all, I would like to say that we are a part of this world. I mean, we are not immune about that. The transportation between the countries, all of these things is one of the things that's affecting the thing. But the idea is to minimize the risk as much as we can. So all the precautions that came from the WHO or from the Ministry of Health, from the CDC Center, and all the people are concerning about the awareness of this pandemic, it should be considered as the priority. I mean, prevention much better than the treatment.
Yes.
So I would like to highlight more about the prevention, the precautions that should be taken. The responsibility for each one of us. I mean, the people, the health staff, the municipality, the volunteers, and such these things. So the coordination between the all the sectors and the city and in whole Libya lead to minimize the cases, minimize the risk, minimize the complication as much as we can. So the self-isolation, the contact with call center, going to the primary health care center that's created for the examination to the suspected cases, all those procedures should be kept in mind. The curfew time, respect the recommendation from the higher authority, from the authority of the city, from the security bodies in the city, from the municipal council, from the high commission committee that's created to work against this pandemic. So it should be respected and should be followed as the responsibility for each one of us.
Yes. Do you think that awareness is the first weapon to face this?
Absolutely.
Yeah. Okay.
Absolutely. Absolutely. The things that the good thing that's in Libya has happened is we get time to know what it is and how we can deal with it.
Yes.
I mean, this is this time is I think it's more than enough for each single family to know about, to read about, to hear about, to ask about, and to listen to all the people that are working on the awareness staff and programs. So I think this is a good thing that's give alert for the people to do. This is most important.
Yeah, we are in need of this.
Yes. And this side, maybe how can you evaluate the matters or the things that we have in social media? Is it a positive or negative?
Yeah, actually, it's one of the positive movement that is happening in the community. I mean, now the social media is the first tool that you use it to reach the people.
Yes.
I mean,
of course.
I think now it's more than the TV or something like that, because each one, it's influence tools that you can reach for each single family, each single family member, either the father or the mother or the older brother or the older sister or the neighbors, all of these things. So it's exchange the news, exchange the information, and this is one of the things that's maybe I put in my mind now. Please take the information from
Of course.
from right resources. I mean, the rumors, the groups or the WhatsApp group or Viber groups, or exchange those information. Please take the information from the right resources.
Yes.
This is the most important thing, either in Arabic or in English or whatever. But to exchange the information between the family member or between the friends or the relative, it's please don't like maybe to chat about something is I heard something or rumor something or something like that. It's not like that.
Yes.
For now, I mean, one of the things that the WHO is advised that take the information from proper resources.
Official places.
Official places.
This is what I wanted to highlight for today, is that we have to take, we don't need to spread more rumors, because it's easy to spread rumors. We need to take information from the official places, such as the Libyan National Center of Disease Control.
This is the official place, or this official body that has the right to announce.
It even has the numbers to call.
Yes.
Yeah.
And the other thing I would like to say that stay away from those rumors. Stay away from those like negative point that's spreading in the communities. Yesterday I met with my neighbor that he asked me how's the condition of those cases in your hospital. I told him that they are not in the hospital.
Yes,
they are in
they
home.
Are in house.
They are then taking care of themselves in the home. So a lot of rumors running in the community should be corrected, and this is the main advice, or the point of my advice. Don't follow the rumors and take the info or the information from official resources.
Regarding these rumors, all of us knows that there's no vaccine for this virus, but some people are transferring, let's not say wrong information, but some things about the things that you have to eat, the things that you have vitamin C and other stuff. What do you think about this?
Like I mentioned earlier, that the healthy food and the healthy lifestyle is the first thing that improve your immune system. I mean, I will not say there is a special food or special supplement you have to take to improve your immune system, but in general, the good healthy food and good healthy lifestyle, it will definitely will lead to a good immune system in your body. So like vitamin C or zinc or whatever, so it's kind of it's supplement, it like maybe improve the system or keep you like in good health condition. It's one of the things that you can take it or you can follow it.
Yes, unfortunately we have reached to the end.
Okay.
It was a
time
pleasure.
goes fast.
Yes.
So.
Yes. It was a pleasure indeed.
Of course, I always have something to say. Dr. Ali, thank you for your time.
Thank you so much.
Thank you for for stating facts for us, because people always have questions. We have questions.
And this is the first episode, and we are optimistic.
Absolutely. So it's a pleasure.
Great opening for the program itself.
Yes.
And this is one of the things that is reach the community through that.
Yes, your message. We want to hear your message for all the community in order to spread the awareness. We have talked a lot about the awareness.
Before we conclude, we need to revise the keywords of today.
Yes.
We talked about COVID-19, Corona as people know it. We talked about the Libyan National Center for Disease Control. We talked about the WHO, World Health Organization. What else would we talk about? Immunity,
Yes.
keywords of today.
And about rumors, social media,
Yes.
and other stuff. Yes.
And I think that's it. And of course, the prevention is better than cure, everyone.
And don't forget to wash your hands.
Yeah, of
Yes.
course.
Yes. So the best way to prevent and slow down transmission is be well informed about the COVID-19 virus, the disease it causes, and how it spreads. Protect yourself and others from infection by washing your hands or using an alcohol-based rub frequently, and don't touching your face. So this is the first episode of the Libyan Digest. Thank you, Aisha. Thank you, Dr. Ali.
Most
Thank you.
welcome. A pleasure.
And yes,
Stay
So,
safe, everyone.
Thank you.
That's it. Thank you.
Thank you. Goodbye. The Libyan Digest.
The Libyan Digest is brought to you by the Libyan Observer.